Hello again, I'm Dr. Nev and I'm a licensed psychologist. This is the final part of my 10-part series of techniques that you can use to help you manage your anxiety. As I mentioned in parts 1 through 9, I frequently utilize these techniques with clients in my private practice, and I hope you have found them to be useful as well. If you are experiencing significant distress, please contact your local psychologist. So in today's video, we will be discussing some of your daily habits which may either be aggravating or helping your anxiety. The first technique is simple but often neglected, and it has to do with monitoring your caffeine intake and also how caffeine affects your body. For some individuals, caffeine affects them very mildly, but for others, it can really do a number on their anxiety. It can make their heartbeat race faster, it can make their palms sweaty, it can make them talk more quickly or rapidly for hours after they've consumed caffeine. So just something to keep in mind. Is caffeine affecting me, and is it something that I can possibly cut back on a little bit to see if it actually does make a difference in my anxious distress? I also want to encourage you to remember that caffeine is not simply in coffee. Caffeine can be in all types of foods that we may not necessarily think that it's in, such as ice cream or pudding or certain cereals and granola bars. So always check the label because you never really know what you're getting nowadays. Another thing to consider is you may also want to avoid taking illegal drugs and also drinking alcohol. Those substances can mix negatively with your anxiety medication if you have medication prescribed by your provider. So I would really encourage you to abstain from those substances and see if that also assists you in feeling less anxious over time. The second technique I wanted to discuss with you today is related to stress eating versus mindful eating. So when we're stress eating, we're essentially just trying to soothe ourselves with food. We're trying to eat something so we feel better. Versus when we are engaged in mindful eating, we're actually making a very conscientious choice to pick something up and put it in our mouth. And usually we do that mindfully when we are truly hungry, versus when it comes to stress eating, we're not always hungry. We're just needing to soothe whatever emotion is going on inside. Most people tend to have their go-to stress snacks. So those can be ice cream or chocolate or cake or brownies, cheesecake, what have you. And one thing I would encourage you to do instead is develop a list of snacks that you can eat during those stressful times that are a little bit healthier for you and that might not produce those feelings of guilt and shame because you ate things that you probably weren't planning on. So for example, having small bags of nuts or fruit snacks or even just, little mandarins, some crackers, little granola bars, just something that can still give you that soothing sensation of eating without you eating something that you did not intend to eat. So planning ahead of time really makes a difference. The third technique I wanted to discuss with you today is about monitoring your sleep. And research studies have shown that sleep deprivation can really do a number on people's anxiety and increase that anxiety substantially. So what I would like you to remember is if you've had a really poor night of sleep, maybe try to be a little bit gentler with yourself and anticipate that your anxiety might increase. So think ahead of time about possible coping skills that you can use throughout the day if you do notice your anxiety levels increasing. I also want to let you know that I am planning a series of videos specific to sleep management, so please stay tuned for those videos. The three techniques that we discussed today, monitoring your caffeine, being more mindful with what you're eating and consuming, and also monitoring your sleep and how it's affecting your anxiety, might sound overly simplistic, but again, when you are struggling with an anxiety disorder, nothing should be overlooked. And you should critically examine all of your habits to determine if they're either helping or hurting your anxiety. The first step is increasing that awareness because you cannot change something that you do not perceive to be an issue or a critical factor in affecting your anxiety. Thank you so much for watching part 10 of my 10-part series on techniques for anxiety management. If you like these videos, I hope you will stay tuned for my upcoming series on depression management techniques and skills. And I also wanted to give you a heads up that I am planning another series, which will be coming in the coming months, that is related to managing symptoms of trauma, which are specific to anxiety symptoms of trauma. So please stay tuned for those and subscribe to my YouTube channel if you would like to be reminded anytime a new video becomes available. Thank you again for your time and take care of yourself.